Hello, my name is Ricardo Gines, and this is my presentation on the changes within healthcare systems in the United States, Europe, and Canada. Significant changes in the U.S. healthcare system. Disease management is one significant area in the U.S. healthcare system that is currently experiencing drastic changes. While the main goal is to eradicate a disease on a national scale, the approach that is being taken now is how can the U.S. healthcare system eradicate a disease while at the same time keeping costs low. Typically, the average person living with a chronic condition tends to use more healthcare services in terms of physician visits, hospital care, and prescription drugs. These increase in numbers of people living with chronic conditions with rising healthcare expenditures have made way for the government to look into a reduction in healthcare use and cost. Instead of having the typical decade-old approach of treat the patient and bill them later, disease management programs have changed in terms of being able to manage a person with a specific chronic condition, improve their health, and reduce the healthcare service use. Delivery of care is also an ongoing change within the U.S. healthcare system, as it has now become even more crucial to care for a patient, and it is virtually impossible to refuse treatment to any patient that walks into a healthcare setting. One of the main purposes of delivery of care is to provide a service in order to better serve the population in terms of cultural competence, workforce financing, information technology, and emergency preparedness. A healthcare sector in the United States is made up of clinicians, healthcare facilities, insurance plans, patients, etc. Some healthcare sectors may be for profit and some may be not for profit. Even though the term healthcare delivery system suggests order and integration, it does not necessarily mean that the United States healthcare system is working together in one pace. Some of the challenges that the U.S. healthcare delivery system is facing today is serious quality and cost problems. In order to support the current U.S. healthcare system, more than 4,637 is spent per capita, which amounts to 13.2 of the current U.S. GDP, which stands for Gross Domestic Product. Patient participation has come a long way since the old days of patients having to carry around their medical records and files. Some of the persistent problems that followed patients and physicians alike were the illegibility of medical records, incomplete files, and the time consumption it took to get from one medical record from point A to point B. Electronic medical records have changed the way patients are able to participate with their physicians by not only having their files ready on a computer-based system, but by also being able to take this file on a nationwide scale rather than having to wait for the records to be shipped. Making patient information accessible is critically important for the reason being that the patient can be cared for safely by having a specific file customized to their prevention and screening needs and indications. Power portals have also made it possible to improve engagement between doctors and patients. An example of this would be if a patient has a weight loss goal, clinicians can now check on the patient at appropriate intervals on progress. The payer payment environment has also been changed as patients are now able to track their cost of services without having to second guess how much the treatments or visits might set them back. The disease management in Europe has taken a very different approach than that of the United States. Instead of seeing how they can overall lower cost in treating chronic conditions, Europe has divided each disease in which they believe is a chronic condition and separated it into charitable contributions. Examples of this would be a diabetes organization that strictly only generates money to take care of that one condition. An example of this would be the way France currently finances their disease management. 11.7% of their GDP is used in funding healthcare, while their main sources of funding come from statutory health insurance, 71%, and voluntary health insurance, 13.8%. Healthcare service delivery in Europe is facing high demand, with the public demanding more ease and access to healthcare services. This has increased demands in the use of new technologies, medications, and models of care with higher expectations and quality of care. Aging populations, along with the emergence of new diseases and old, have further challenged the European healthcare system. The uncontrolled uses of antibiotics has led to an increase in antimicrobial resistance, which has turned affected disease control. Unfortunately, patient participation in Europe has long been known to not be well documented. Although there are various support groups across Europe that can help a patient with their health needs and chronic conditions, people tend to seek additional information through social support and several informal and informal patient organization groups. Even though there are many patient organizations across Europe, there is not much to be researched on how they have impacted health policy decisions and reforms. When it comes to disease management in Canada, their citizens tend to turn to primary healthcare services as their first point of contact. If their needs cannot be met with their primary physician, then the physician will require them to seek more specialized care with a specialist or a hospital-based service. This form of responsive model has served the citizens of Canada well up to recent years, where aging populations, rates of chronic disease, and healthcare system needs are needing a response from the Canadian healthcare government. Many physicians have expressed their concern in working long hours just to care for an individual patient, and their needs have yet to be a stable implemented disease management system in Canada. Delivery of care in the Canadian healthcare system differs in many ways from the United States, as many people have opted towards Canadian healthcare over healthcare offered in the United States. Canada currently has a single-payer universal healthcare program for every legal citizen. All Canadians have a funded healthcare plan for life. Patients have the freedom to choose who they receive care from and never worry over medical bills even if they lose their job. Currently, their healthcare system is funded through tax revenues, so ultimately this means that the Canadian government is strict in tax payments towards health services. Physician fees are predetermined by the government and prescription drug prices are kept relatively low in order to keep costs low. Canada has a health system that many other countries ultimately envy, but this does not mean that they are perfect. Patient participation has drastically helped reduce the number of people who die from infectious disease, as patient engagement currently holds the potential to improve health outcomes and superior care experience, as well as improve the Canadian healthcare system to a more sustainable level. More than 200,000 people get infections every year while they receive treatment in Canada. As a result, 8,000 of these patients die each year. Canada plans on reducing these numbers by implementing more advanced health services other than EMRs and video screenings with physicians. When comparing the United States, Europe, and Canada to disease management, it is clear to see that Canada clearly has the upper hand, while Europe falls into second place and the US into last place. The reason for this is because Canada actually has a universal healthcare system where everything is paid for, unlike Europe, who has individual funds to take care of these type of problems. The United States, on the other hand, aims on lowering costs, but not necessarily helping to fund the fight against chronic diseases. Canada also has a better delivery of care compared to that of the United States and Europe, as their healthcare workers are working on a fixed salary and patients have a right to choose who they want to be treated by with no extra cost attached. This not only helps keep costs low, but prescription drugs low too. Patient participation is far more superior in the United States compared to Canada and Europe. The United States has not only been able to implement ways to treat their patient via wirelessly, but have also found methods to keep up with their health by having health systems create apps that keep physicians up to date with their patient's heart rate, blood pressure, and even their weight goals. This, on top of advanced EMRs, have changed the way the United States healthcare system treat their patients on a day-to-day basis. Europe currently struggles to maintain a proper patient participation plan, as there is little to no research done on how they can improve patient life expectancy. According to the chart on the screen, the United States clearly spends more on per capita and their GDP, but this does not necessarily mean that they have the better healthcare system. Although they spend more, Canada still trumps them and Europe, and that's because they spend less. The chart in the previous slide shows a clear indication on how the three nations, the United States, Europe, and Canada, are spending their money towards healthcare. The United States spends more on healthcare per capita than that of Europe and Canada, with Europe coming in second and Canada in third respectively. The same can be said about the average spending of the GDP in these nations. The United States once again comes in first while Europe takes second and Canada third. What can be learned from this? According to the graph, even though the United States currently spends more on healthcare, it does not necessarily mean that they are able to implement it better. Canada currently holds the top spot in two of the three areas, which are disease management and delivery of care. Patient participation is something that the United States does have over Canada, but does patient participation justify better healthcare services? No. Canada has ultimately found a way to utilize all their services to their citizens so that costs are kept low while at the same time being able to provide reliable, life-saving services to their people without them having to worry about their money being spent. The United States, on the other hand, offers services in terms of disease management and delivery of care, but at a price not many can afford. Even when funds are not available to their citizens, not everyone is guaranteed a spot to be cured from their illnesses. Europe falls short in all three areas as they have properly organized their disease management funds, but not enough to trump Canada, but still well enough that they can offer better services to their people than the United States can. In order for the United States to be able to improve their healthcare system, they must first be able to have an appropriate response to disease management. One of the concerns the United States healthcare system has with disease management is improving health while at the same time reducing costs. Although a universal healthcare system is not in the near future for the citizens of the United States, proper funds can be contributed to various disease organizations in order for people to feel more secure about fighting their terminal illness. This is the same type of system that Europe currently has. Comparative effective research can also contribute to the improvement of the United States healthcare, as comparing the risk, benefits, and costs of certain procedures patients go through can not only save patients money, but can drastically reduce the United States healthcare GDP. Reforming healthcare and delivery systems are complementary to each other as successful payment and delivery reform is needed to increase the value of healthcare by having better quality care and slower cost growth. In return, Americans will be more likely to purchase health insurance coverage as it becomes more affordable and valuable.